This is a 6 News special town hall, the opioid crisis in the Commonwealth, hosted by Sean Eiler. Sponsored by Somerset Single County Authority for Drug and Alcohol.
Thanks for joining us for this special 6 News town hall. We'll be facilitating an important discussion, drugs and addiction, issues that continue to plague our communities. And now there's rising concerns about new, more potent drugs being added to the mix. We'll be talking with local experts throughout this town hall about addiction, the path to recovery, and the impacts on our communities. I'm joined by Natalie Kaufman, the executive director of the Cambria County Drug Coalition. Natalie, thanks for joining us. For those watching at home, tell us a little bit about yourself.
Well, thank you so much for having me, and to the entire team here at WJAC for making this possible. So the Cambria County Drug Coalition is the nonprofit organization in Cambria County focused on all things substance use disorder related. We follow a national model for community change out of the Office of National Drug Control Policy, which is really exciting. And the way that we do that and what that looks like in real life is we have 9 committees of community members, everyone from law enforcement to faith-based to media to business, schools, and even youth are engaged in our work and in our initiatives. And we are federally grant funded, and every day we work to create drug-free communities in Cambria County by engaging all members of the community to fight for recovery.
And we appreciate you joining us and adding your insight as we talk about all of these topics.
Absolutely. Looking forward to it.
Thank you. We start with one of the drugs amplifying the opioid epidemic over the past several years, fentanyl. It's a powerful opioid that authorities say they're seeing more and more of. Drug dealers are mixing fentanyl with other drugs because it's cheap and very addictive. This makes it especially dangerous because oftentimes a person using drugs may not even know what they are using is laced with fentanyl. It only takes a very small amount to kill you. Our Zach Kay spoke with doctors and investigators about this deadly mix.
Fentanyl use has increased steadily over the last several years. The Center County District Attorney says they are now seeing it being sold in pills. It has a lot of appeal due to its cheap prices and high potency, but it can also be deadly. There have been 7 drug-related deaths in Center County so far in 2023. 4 of them have involved the use of fentanyl. The district attorney says one of the major problems is mixing it with other drugs, and how it's nearly impossible to know if another drug has been laced with fentanyl.
You can't tell. You can't tell. Your neighborhood drug dealer doesn't always tell you the truth, and people think they're buying one thing, and it turns out to be something that has fentanyl laced in it. In one case where we had an overdose that did not result in death, it was a fentanyl pill. And the action and the effect is almost immediate.
Dr. Apendra Thacker is one of Mount Nittany Medical Center's chief medical officers who specializes in pain medication. He says they use fentanyl when treating patients, but the dose is 50 to 100 times smaller than a normal dose of morphine. He says that when it is used outside of a medical facility, it becomes very dangerous.
When you take it recreationally without that quote-unquote titration, you're able to overdose yourself with it. The other big thing is that fentanyl is very cheap and easy to synthesize illicitly.
Due to how cheap it is to produce and purchase illegally, both Dr. Thacker and the district attorney don't see this problem going away soon.
Because there's no substitute, and because it's difficult to get into rehab programs because of lack of availability, insurance coverage, costs, etc. And when you have an addiction, it requires specialists to treat that.
The district attorney tells me that the Center County Drug and Alcohol Office is primed and ready for individuals to reach out and seek help. For more information on what services are available, head over to our website. Reporting in Center County, Zach Kay.
We're now joined by Ryan Sayers, the Clearfield County District Attorney. Now, Ryan, in the story we just heard, we heard from Center County's District Attorney Bernie Cantorna. He talks about there's really no way to know when fentanyl is in a substance that someone is using. Can you explain to the people at home just how potent this drug is and how little it takes to kill somebody?
Well, first off, thanks for having me here. This is a really important topic that we're seeing all across the Commonwealth. We regularly talk about this and a few other drugs that are synthetics that are coming into the market and really killing people in our community in droves, and it's a plague. But in regards to fentanyl itself, I actually have a couple props here to explain it to the people at home. So the first is a standard number 2 pencil. And the DEA says if you were to take powder and just sprinkle it over just the graphite part of the tip, that is enough to kill somebody. So 0.02 grams. The other way to look at it is standard sugar packet. Took it from the break room here at the station. This is standard on a coffee table at a restaurant is 1 gram. This is enough to kill 500 people if this were pure fentanyl. And that's the scary part, because we're seeing people that are having 10, 20. We had one person in Clearfield County had 60 grams. And you think about that one bust was enough to kill half of the people that live in Clearfield County. Just that one. So it is such a powerful drug. And it's in everything now. It's being every other drug, marijuana, meth, heroin, it's all being mixed with fentanyl in such lethal proportions.
And Natalie, you and I were discussing this the other day in some of our meetings leading up to this. Ryan, if you give a guesstimate as to what the thought process is behind this. You have a drug dealer whose their goal is to make money. They're doing it in an illegal way, but it's a business for them. What is there to gain whenever you're having such a lethal substance put into a multitude of drugs and substances?
The sad part about it is the individuals that are getting high off it, it's a more intense high. That's what they're looking for. So if they don't die, they have a really intense high from it, and that's what they're searching for. And that's what the body's searching for when you become addicted to these substances. So at the end of the day, they're getting a more incredible high, and for some people, it's killing them.
And the drug dealers are looking at this as that's the cost of doing business. I could get X amount of people addicted. We may lose 1, 2, 3 to an overdose, but they look at it as, okay, more people are addicted. It's just a vicious cycle, it seems like.
Well, and the other thing, too, is fentanyl is incredibly cheap. It's incredibly cheap to produce, to get here. It doesn't cost them a lot to add that to the other drugs that they have. So cost of doing business is the way they look at it.
From your perspective, how has the fentanyl situation evolved in your area as we've looked at the opioid epidemic from start to now?
So I've been in office now 4 years. When I first came into office, it was pretty much all methamphetamine. Now what we've seen over the last year or two is more fentanyl, more heroin, and fentanyl cutting everything. And meth is obviously still the primary drug, at least in Clearfield County, but it is being cut with fentanyl. So I guess it just changes when I talk to other DAs that have been in office, a couple decades, or older attorneys. They say, looking back into the 80s and 90s, that was the drug of choice back then, was heroin. And it's just a roller coaster on what people want at different times. Just like any other part of the economy, stuff comes in style, stuff goes out of style.
You mentioned it, things have changed over the years. Also, the way that drug dealers sell these drugs and that consumers go out and buy and they perform these drug deals. Talk about the evolution you're seeing. This isn't just hanging out on the street corner anymore and doing a quick handoff.
No, nowadays it's a lot of technology. I know with prosecutions, we are constantly looking to get into people's cell phones, Gmail accounts, Snapchats, all those things, because that's how people are communicating in order to do that. And with the small size of fentanyl, as I said, sugar packets enough to kill 500 people. It doesn't take much to conceal that. So they can meet in public and do that. It's not like a large bag of marijuana or something that's a little harder to conceal. So yeah, they can go and handshake and keep on going. And when you see what people have in their pockets, that's what we're talking about. Small amounts, but it's lethal.
Why are we seeing it more frequently in our communities now?
That's hard to say why most of the cases now. I was looking at it for, I forget who I was looking at it for, but Clearfield County has 1,300 to 1,400 cases a year. And we figure probably 2/3 of them are drug or drug-related. So we have obviously the trafficking and the use, but then we also have thefts related to it, burglaries, assaults, sexual abuses. It's all related to drugs. And why that has come into the area so much, it's hard to tell why so many people are using.
Yeah, it speaks to the potency of it as well, I would imagine.
And I think too, Sean, when you think about kind of the evolution of the drugs and the potency of the drugs. We talked a little bit about this, of how our brains react to substances. So we've all experienced having our cup of coffee in the morning and it just didn't do the trick. So we got to have that second cup of coffee. And so having our brains adapt to substances. So as someone if someone is in active addiction and is using substances on a regular basis, they're going to have to continue to increase the potency, not only to feel relief and get high, but also to just keep from being sick. And so I think that that's another reason why the potency of these drugs is so popular. And plus, as well, there's some drugs that, we see fentanyl poisoning happening where the person did not realize fentanyl was in what they were purchasing. The DEA has an entire campaign out called One Pill Can Kill, and talks about how youth are targeted with medications that they think might be a Xanax or an Adderall, and it has fentanyl in it. And so I think that it's a very tangled web of reasons, but I think that a lot of it is just the progression of the disease of substance use.
Well, and the other part of that too, the DEA campaign is. You always hear about that. Somebody in high school says, "Hey, why do you want to try marijuana?" And people say it's not a gateway drug, but it's hard to say that it's not, because now it's being laced with fentanyl, and we are seeing where somebody's trying a drug for the first time and they're overdosing and or dying.
What are some of the, I would say, not expected drugs that you're seeing more of now being laced with fentanyl?
All of them. I mean, it's meth, it's heroin, it's marijuana, it's straight fentanyl. Cocaine, yeah.
Cocaine's a huge one because it's both white powder. So how do you differentiate? And, we discussed this as well. Unfortunately, recreational cocaine use is somewhat socially acceptable in some circles. And, it's not safe. And it, as we said, the drug dealer can take their customer that they see maybe once a month on a regular, recreational basis, and turn that customer into someone that's in full-blown addiction that's needing to come see them on a daily basis.
And what we're seeing with that too is people that are incarcerated for a period of time. They're going in as a heroin addict or a methamphetamine addict, and when they come out, they think they can still use the same amount, but they're running into now being laced with fentanyl, and they're overdosing right out of jail because they're not ready for that. They're not used to that.
Yeah, and just as we discussed with overdose death, in recovery, if someone's been in recovery for a long time, they pick up and use the amount that they used before. And our brains, just as our brains escalate and get used to the level of substances, it also de-escalates. And unfortunately, their brain can't handle that amount of substance, and it causes an overdose death.
I understand you can only speak so much to active investigations that your office is looking at, but without giving away what you're looking into, is there patterns that you're seeing as far as where fentanyl and some of these other illicit drugs are being trafficked in from?
So I can talk about a couple that have occurred in the last few years. The U.S. Attorney's Office, in conjunction with the PA Attorney General's Office and the DA's Office, State Police, there have been a couple joint operations, and it's all coming from Mexico in some way, shape, or form. One operation was coming out of Atlanta to Erie to central Pennsylvania to Clearfield County. The other one was via the mail. It was being put in the mail and brought from the western part of the United States. So it's just coming from out west, down south, but basically from across the border.
All over, it seems like. It's like you said, it originates down there, but once it gets into our country, it just from one stop to the next. And I've read and have seen other documentation on the drug trafficking trade. Is it fair to say that at each stop these drugs make, it's getting cut again, and the potential for more illicit substances like fentanyl to be mixed in at pretty much each stop? As they pretty much, a drug dealer gets a product, they cut it in half so they can make more money, which means they're adding in more additives, possibly more fentanyl. Is that safe to say?
Some of it. I mean, obviously, cutting it with fentanyl is happening along the way, but some of the stuff that we have been seeing, especially the methamphetamine, when it's getting to the end user and it's being tested, it's being they're seeing it 98, 99% pure methamphetamine. the shaker bottles or, home labs were, 10, 15, 20%, somewhere in there, purity. I mean, the stuff coming out of the super labs in Mexico is incredibly pure. Now, whether they're changing the weights, saying it's 5 grams and it's only 4.5, that's why we see a lot of users, in addition to the dealers, having scales, because they're trying to make sure they're getting the full amount of their dollar's worth.
And you mentioned people being incarcerated. The drug epidemic, the opioid epidemic, obviously has a direct effect in the communities. Talk about the impact it has on the crime rate in your area.
Well, as I said, I mean, probably 2/3 of the crime in Clearfield County is either drug or drug-related. If we could somehow take that out of the equation, we'd be dealing with people that need help that are going to steal just for their own personal use, not to steal to pay for a habit.
Oh, I think you're seeing crime that is not necessarily drug-related, and I think when you look at those that are engaging in drug activity, that are so you've got kind of two, and you could probably speak to this as well, like there's kind of two different categories of folks that are involved in illicit drug trade, right? It's the drug dealer who probably isn't in the depths of active addiction. They wouldn't be able to run their business if they were. And then you have the person that's in the depths of substance use disorder that are just trying to keep from getting sick.
Absolutely.
And so, it's the drug dealer that's driving that drug trend. And unfortunately, the person that's caught in the addiction is also engaging in illegal activity to function as well.
Yeah, and we see a fair amount of people that will sell a small amount to provide for their habits. So it's really 3 categories, but those people that are just using or selling just enough so they can use, I mean, those are the people that the system is trying to target to get them help. Obviously, the drug traffickers, the drug dealers, those are the people that we want to put in state prison, federal facility, and be done with them, put them away for 5, 10 years or longer if we can. But the people that need help are those people that are just using and trying to break that cycle of addiction.
Yeah, that leads into one of the other questions I had for you, Ryan. How do you balance the, punitive measures with a focus on getting these people help? Because kind of like you said, there's a difference between the crime that is drug dealing, and there's a difference between the crimes that people that are in the throes of addiction are committing to fuel their substance abuse disorder.
Right. And I mean, that all comes down to the term that everybody knows is prosecutorial discretion. At the end of the day, that's what it is. And I think that as a general rule, prosecutors look at it as I just described it, where if you're really trafficking, if you're the one moving it and bringing these substances into our community and being that plague, you need to go to jail. There's no help for you. No rehabilitation. Go to jail, directly to jail. Don't pass go. None of that. On the other hand, those people that are just using, and they're recidivists too. I mean, we see people that will have just a possession charge or a small amount, and then they're on probation for a year, and they can't make it a year without using, so they get caught, and they're on violations, and it's just this cycle. So that's where, as prosecutors and probation officers and, the Attorney General's office has the LETI program, different counties have drug courts or veteran courts or DUI courts. All those things are meant to divert people and get them the assistance they need to help break that cycle.
And because, we know that substance use disorder is linked, the main risk factor for that is unhealed trauma or stress, right? Nobody wakes up in the morning and uses substances because they have such a great life and are having such a great day. So they're using substances in order to cope. And so, of course, the stress of having a court case or having, being on probation, that is extremely stressful and puts that individual, that very vulnerable individual, in a stressful environment. So to that point, I mean, drug court, veterans court, DUI court, those are all options and really great ways to give people the opportunity to get the help they need and the treatment to help and heal the disease of addiction.
Yeah, and we've seen that where individuals will be coming in for sentencing and it's just for probation. It's not like they're even going to jail, or if they are, it's 72 hours, something like that. But they come in higher than a kite. I mean, they come in where we had one individual that was barely able to stand, another one that's fallen asleep in the benches waiting for the case to be called. We've seen it time and again, as you said, the stress. Yeah. And it's not just trauma, but we're also seeing it's tied to mental health.
Oh, absolutely.
I mean, the mental health crisis right now is huge because those two things are linked: drug use and mental health.
I'm glad you touched on the mental health portion. We have just two more quick questions for you, so we appreciate your time. The first one I have is kind of playing off the mental health thing, between mental health, the access of naloxone, better known by its name brand of Narcan. These are two topics that have become more and more discussed, more and more available. Are there any efforts underway in Clearfield County or that your office is a part of regarding mental health or Narcan, things that you feel are good tools that could help solve this problem?
Well, I know all the police departments, EMS, I think some of even the fire departments, they all have Narcan so that they can administer it if they come upon a scene. Clearfield County Jail does as well. So I know it's out there and people are trained on it, know when to use it. Sometimes, though, it takes 2, 3, 4 of these canisters to bring somebody back, which is scary. I mean, they're that far gone that it takes that much of the drug to try to bring them back. As for mental health, I mean, it's part of the system. The problem is right now is, as a totality, the system is not able to handle all the mental health that we have in the state. I mean, we have individuals that need to go and be evaluated at Torrance State Hospital or Warren State Hospital, and they are waiting months. So they're sitting in Clearfield County Jail waiting for an evaluation. Sometimes the psychiatrist, psychologist will come to the jail and interview them there. But in order to get them the help they need, it takes time. And that time, obviously, is time they're not going to get back in the healing process.
That's a really great point. That's not time that they're going to get back, I think, is really important. And so to kind of touch on, the Narcan and the resources that are available, which I know we're going to talk at length about Narcan a little bit later in the program. But I think that, the first responders really have that opportunity where they're engaging with that person in their worst moment. And certainly compassion fatigue is a real thing with first responders, and we know that. But if we can continue to inspire that compassion in that moment for the person that's experiencing substance use disorder, I think that makes a world of difference. And just to even hear, law enforcement and, those that are the punitive agencies, so to speak, saying, we recognize that this is a disease. We recognize that this is something where these people need help. They can no longer help themselves.
Well, and that's why the Attorney General's office a few years ago started the LEDI program, and Clearfield County signed on to it, 2 years ago now. And it's important because it's the Law Enforcement Treatment Initiative, and it's meant for people to go to law enforcement and say, I have a problem, can you help me? Not go and get handcuffed or taken to court or whatever's going on. No, we're going to go to law enforcement for help. And that's trying to change that mentality in the communities that law enforcement's meant to help you even though you're using illegal substances.
Ryan, before we get moving on to our next segment, anything else that you want the public at home to know about?
The big thing that I just said is if you know somebody that needs help, please contact your law enforcement agency near you. They would be able to get you in contact with the people that can help you get services, housing, treatment, psychology, those things that all exists out there. So please, if you yourself or a family member, friend, neighbor, anybody needs help, please reach out and get them that help and help break that cycle of addiction.
Ryan, thank you very much.
Thank you very much. It was a pleasure.
Thank you.
Recently, authorities say they're seeing an escalation, a drug that naloxone can't treat. It's called xylazine, and it's known on the streets as Tranq. That's because it's a form of an animal tranquilizer. It's meant to be an anesthesia for animals, but it's now hurting human lives. Brock Owens tells us more about this deadly drug and why local experts are warning against it.
Cambria County District Attorney Greg Niebauer says the supply and consumption of xylazine in humans is continuing to rise over the last several years. But doctors warn against the drug, saying it can cause sudden death. Officials say xylazine is a drug not intended for humans, but rather horses or cattle.
Xylazine is commonly used in veterinary medicine as a tranquilizer. It works centrally in the brain on the alpha-2 receptors, and it produces muscle relaxation, pain control, but when mixed with illicit drugs, it can cause difficulty breathing, low heart rate, low blood pressure, and ultimately death, unfortunately.
Medical providers say it's also referred to as a zombie drug because of another effect xylazine has on humans.
Xylazine is ingested or injected, and with that injection can come skin wounds, skin ulcers, abscesses, and that can cause secondary spreading of disease, various bacteria.
And authorities say it does not even need to be ingested to cause harm.
One of the first cases that we've had is actually someone that was using it on a baby changing station at a gas station in Winburn. Someone could have put their baby on that baby changing station and really caused a serious injury or death.
State Representative Carl Metzger says he's the prime sponsor of a bill that passed through the House and could soon be looked at by the Senate that would make it so a prescription from a veterinarian is required.
This bill would make it a felony, punishable up to 5 years just for the illegal possession.
Making xylazine even more dangerous, according to doctors. Its antidote is not available to as many people as the counter to some other lethal drugs.
One important thing to know about xylazine is because it isn't truly an opioid, Narcan doesn't work.
They say its antidote is tolazine. Doctors say their main message is the potency of xylazine.
In that it's used to tranquilize large animals, it can cause sudden death. That's extremely dangerous.
Medical personnel also say if you see someone suspected of overdosing, you can provide Narcan if available and make sure to seek help as quickly as possible. Reporting, I'm Brock Owens.
We're joined now by Dr. Jean Spencer with Conemaugh Health System. She's the Family Medicine Residency Director there. Dr. Spencer, thank you for joining us for this discussion.
Thanks for having me.
First question I have for you, are you surprised to see an animal tranquilizer being used by humans the way that we're seeing it with xylazine?
Yeah, I think so. I mean, I don't think, as somebody who doesn't use illicit substances, that it would ever cross my mind to think that that would be a good idea. But somebody came up with this.
Because we were mentioning in our pre-meeting that elephants, horses, we're talking massive animals this drug is meant for, but the throes of addiction have brought people to use it for recreational purposes. Explain some of the close and personal instances that you've seen with your practice.
Well, so I think people use xylazine, or tranq as they call it, to try to augment their high. And so they, if they're already using opiates, then adding this on top, I think, can give them a better high or bigger high. So that is, I think, why they use it. Also, sometimes people are on methadone, or it could be on Suboxone. And if you use the xylazine on top, you can get somewhat of a high where you would not if you used used opiates. So, but the real risk, I think there's two big risks. One, I mean, similar to fentanyl, it's very potent, so tiny amount can cause a lot of damage. But the really unique thing about xylazine is that when it's injected, it constricts the blood vessels, so it tightens down the blood vessels, and so that can cause your skin to basically die. And so areas of your skin the technical term is infarct, but so it dies, and so then you get horrible wounds, somewhat similar to a burn, but very painful wounds that are open, but they're also very prone to infection. And so you have people who have, sometimes pretty big areas of skin basically sloughing off, and then the bacteria, that's a nice portal of entry, and so they can get horrible infections even throughout their whole body and in their bloodstream, with the entranceway being this open skin. Those are
Unimaginable side effects for someone looking at it outside looking in. Natalie, it really does paint the picture of how severely addictive that these substances are. I can't imagine having my skin dying and having these kinds of wounds, but then continuing to go back to that same substance that's causing that problem.
Yeah, I think this is where, when we look at this situation and say how or why would someone ever do this to themselves, beginning to understand the brain science behind substance use disorder and understanding that substances work on our dopamine receptors, which is our kind of our reward pathway or our, habit pathway. It really hijacks the entire system of decision making. And so to kind of back up what Dr. Spencer said, in that it augments their high. They're no longer necessarily getting that euphoric feeling because their brain has adapted to the amount of drugs that they're using. So they're adding in xylazine, which gives them a bit of a euphoric feeling as well as keeping them from getting dope sick and going into withdrawal. And I think it just kind of paints the picture of truly the brain disease. This is not fun for anybody that's experiencing it. The party's over, so to speak, at that point. And, they're just their brain is directing them to do what they need to do to stay alive in their mind. And so that's where, the resources for treatment become so vital to say, you don't have to live this way. But also, speaking to the wounds, what we would refer to as tranq wounds or the xylazine wounds, unfortunately, those that are in active addiction are often unhoused, are often, don't have a comfortable, clean, warm shower and bed to go home to. So they're even more at risk due to lack of hygiene. And is that something that you would say would be a concern as well?
Certainly, and I think on top of that, you have the stigma of drug addiction. So whereas, if I burned myself in the kitchen, I wouldn't be embarrassed, or maybe a little bit embarrassed, to go and say I need help because I've got a burn. But, if I know that I have a wound from injecting drugs, I'd be much more reluctant to go seek help. And so I think that's another part of the problem is that, they're not going to be, buying antiseptic and taking care of their skin like you would if you weren't. And I think something that Natalie said is I think people who've been having the addiction for so long, they really don't get euphoria anymore. They're just trying to avoid dope sickness. And so it's really not a good life at all. It's just misery trying to make sure that you can get your drugs so that you just don't get sick. And it's not euphoria anymore.
We talked about this on Monday night that, we all have experienced, or most of us have experienced, not having our coffee in the morning, missing our coffee or missing our, Mountain Dew or Diet Pepsi, whatever the case may be, and getting that headache. And so that headache is just one small percentage of substance withdrawal. And our brain is withdrawing from the caffeine. And so we've experienced that headache, and the withdrawal and the dope sick that people that are in active addiction experience is just a million times worse. And, so imagine if you're drinking as much coffee as you possibly can through the day just so you don't get a headache, but it's no longer giving you any sort of energy. It's no longer giving you a pep in your step. You're going to look to an additional substance. And so when we kind of break it down that way and kind of bring it down to experiences that we've all had, I think that that's really what makes substance use disorder and the brain disease of addiction an understandable affliction whenever we look at it that way.
And one of the other things that we've learned about tranq is that Narcan, the popular opioid overdose reversal medication that has been distributed and been recognized by a lot of institutions, tranq it does not work on, correct?
Right. So it works on the opiate receptors, which is a different receptor than what xylazine uses. That being said, if somebody has overdosed in front of you, it's still worth using the Narcan because pretty often it would be mixed. So if there were some fentanyl, because it really, I don't think that xylazine is often alone. So it would be with the other substances so that if you do use the Narcan, you can at least hopefully get them so maybe they're breathing and you can get help. So I don't think it's a good message to say, oh, well, it doesn't work, don't try it. Yes, try it and dial 911 because you want to try to get them help.
And we mentioned some of the wounds that they get from using xylazine. You mentioned some people may feel embarrassed, like, okay, yes, I'm using this animal tranquilizer as a drug, it's giving me this. They may be too embarrassed to come forward. Have you seen anyone come through your practice that maybe shows wounds that you suspect that could be coming from this?
The ones we've seen have really been in patients who've overdosed. That's when they've come to our attention. I suspect that there are smaller wounds that probably they're not seeking medical attention, but the ones that I've seen in the hospital that's been in the setting of a pretty significant overdose where they are admitted to the hospital. And fortunately, those people have been saved, but when they wake up, they've been really pretty miserable with pretty big wounds.
How frequent or common, or maybe even not at all, would you say you see people coming in with xylazine wounds?
They come in batches. I mean, currently, right this month, I think there aren't very many. I think the dealers, sometimes I think they're putting xylazine in stuff, and sometimes they're not. And so the consumer has no way to know, but knock on wood, right this month, it's been a little quieter. In the summer, it was worse. So there are test strips to test for xylazine. And, so I think there's an effort to try to get the word out that, there's a concept called harm reduction where, I think most people with addiction realize that not being addicted would be a better path. But there's a time before they can get to sobriety. And so when they're on that path, at least harm reduction can keep them alive. So, for example, not using alone. If they have the Narcan, if they can use test strips to test a small amount of whatever they're about to use to make sure it doesn't have fentanyl, doesn't have xylazine in it. Those are some of the methods to try to, maybe make the best of a really bad situation. So I think there's kind of a second message of, you can't just tell somebody in addiction don't use. I always kind of joke and say they know that. Yeah. But I think what I have found is when you speak to somebody with addiction and you talk to them about harm reduction, they often are more willing to listen because they've been preached at enough. Most of these people have had people say, well, just stop. And yeah, sure, that's easy to say if you're not having addiction. So I think harm reduction, clean needles and, cleaning your injection site, trying to use, I don't know how you can have a reputable dealer in the current world. I don't think you can know what anybody has put in whatever. So that's really tough.
The wounds that you described aside, what are some other visual side effects that a loved one or a friend can be on the lookout for in someone that could be using tranq?
So it's injected, so there can be track marks, so it can look like, that they have, puncture wounds, so to speak. People who've been using for a while and injecting for a while, they end up using kind of everywhere. So they'll inject in their neck, they'll inject, in their groin, wherever, just because they run out of the usual veins. I think anybody who's had blood drawn, that they have like that one vein. Well, if you're having addiction, you kind of you wear those out, they get scarred down, so they end up using all over. So I think there can be skin wounds. Of course, change in behavior is often a sign of addiction, or, people having less interest in the activities that they used to enjoy.
Before we move on to our next segment, anything else that you want the public at home to know?
No, I think mainly, I think it's really good that you are taking the time to bring this subject to light. I think in our community, I think as we started the Drug Coalition, I think we've made some progress that, people are understanding. I think we've gone from a real punitive approach to, really understanding that these are, fellow human beings who happen to have an illness, and, I think working to help them, I think, is what's best for everybody.
Thank you, Dr. Spencer, for your time. We appreciate it.
Thank you.
Even though naloxone cannot reverse the effects of xylazine, officials say they're still seeing the positive impact of the life-saving drug. As naloxone is becoming more and more available, officials in some areas say they're seeing overdose deaths go down. Stoker Wise Zurich spoke with some local coroners about what they're seeing.
To date, our numbers are down from last year in 2022.
County coroners in our area are shedding light on local overdose deaths from opioid drugs. Somerset County Coroner Colin Swank says he's only seen 14 reported overdose deaths this year, comparing that to 2022, which saw 30. He says he hopes our region can work to eventually eliminate those numbers.
We are seeing naloxone in a lot of tox reports because it does show up. And a lot of EMS, do administer if they're available. They are readily available on the EMS, on the ambulances.
Experts say naloxone is used by emergency crews to quickly reverse the effects of opioids. Responders say you should administer it first before performing CPR. Doctors say it will restore normal breathing within a couple of minutes. According to the Substance Abuse and Mental Health Services Administration, it can be given in doses of 8 milligrams with one spray to the patient's nostril. Even with these measures, former nurse and current Blair County coroner Patricia Ross says some of the drugs like xylazine are so strong that the effects of naloxone won't be enough. She says overdoses and deaths from drugs in Blair County have stayed high. Xylazine is a drug that doctors say is meant to be used on big animals like cows. This on top of the incidents that Ross says she has seen happen before an overdose.
If I find a baby dead in someone's bed, and I find out that those parents are methamphetamine users and or fentanyl and or drug alcohol users, and they were so overcome by the drugs they were using that they laid on their baby and suffocated the baby. Not on purpose, but accidentally, because they were inebriated.
Coroners, including Ross, say more drug testing in schools is what they would like to see, as a person's brain in college isn't fully developed yet. Ross says the denial of admission to higher education for using drugs would motivate young learning minds to stay away from them.
We're joined now by Somerset County Coroner Colin Swank, who you just heard from in that story. Colin, thank you for joining us this evening. Talking a lot about fentanyl and the overdose deaths that we're seeing, not just in Somerset County, across the state, across the country. Naloxone, better known under the name brand Narcan, that's been pushed out into the communities a lot more. I know Pennsylvania has legislation allowing you to get it over the counter. Talk about the difference you've seen in overdose deaths and compared to maybe how less we're seeing that because of the use of this life-saving drug.
I mean, our numbers are certainly down from last year and previous years. I've been in the office for 3 or 4 years now, and it's increased every year. Last year, we had 30 overdose deaths. This year, we're at 14 to the date. So, I mean, it has to have some effect.
Yeah, that's awesome. At that time you could cut things down in half.
That's half.
Yeah. I mean, the year's not over, but
right. And that's similar to what we're seeing in Cambria County as well. We had seen a decline from the original peak of 2016, but then another spike during COVID, and the fentanyl infiltration. But same thing, we are seeing a decrease, almost at a half. Similar situation. So I think last year we ended at 89 overdoses, and this year we're sitting at 44. So, and then again, overdose death.
Yeah.
So
and
cutting that in half.
Cutting it in half. These are great improvements. And I'm sure there's a lot of factors at play, but I would imagine safe to say that the use of Narcan has helped your office.
It's definitely helped. Yep.
Are there any challenges to getting Narcan out into the community more, or getting more departments, first responders to use them?
I mean, they have them. I know UPMC is great with distributing them to first responders, especially fire, EMS. I mean, it's out there. The resources are there. Department of Health's great with getting Narcan out to families, and
For the go ahead, Natalie.
I was going to say, well, it's interesting just from a Somerset County and Cambria County perspective. The Cambria County Drug Coalition is the drug-free communities nonprofit in Cambria County, and Somerset County has a similar organization actually called Somerset County Drug-Free Communities. So it's really a great parallel to see both initiatives, getting Narcan into the hands of first responders, but also into the hands of just regular community members, a loved one of someone that's experiencing substance use, really standing at the ready to save a life. And I think that has been a huge, and just the overall stigma reduction, I think, as well, and understanding how Narcan works has been a huge improvement.
I'd imagine it gives you and other first responders an extra, sense of security when you're showing up to these scenes, because you're assessing and treating people that are overdosing or have, in your case, have since passed. But it's got to be frightening, or at least in the back of your mind, knowing that somewhere in this room there could be granules of this substance that caused this person to die.
That's the tricky part. I mean, they can be absorbed transdermal, airborne. So I think, yeah, that's a big thing. The family's making sure, you know, what they're touching. First responders as well, you know, wearing proper PPE, your masks, gloves. Just be aware of everything that you're getting involved in.
Absolutely.
At the scene.
Yeah, and thankfully we have not seen any really reports, and again, speaking for Cambria County, I don't know for Somerset, but we haven't seen any reports of a civilian reviving somebody with Narcan and overdosing themselves. Again, touching the powder, the powder won't go through your hands. It has to be either liquefied or in a patch. So the powder touching your hands isn't an immediate overdose. You know, we hear the urban legends of, oh, it's on the, you know, the gas pumps. If that were the case, we'd see people, unfortunately, passing away left and right just by going to get gas in their car. But what it does go into the mucous membranes. So that's where touching the fentanyl or touching a substance, and then how often do we touch our face, right? God forbid, for, you know, a loved one that has lost their child or their loved one, and they're maybe cleaning up the drugs that were there and then touching their face. It's getting into their mucous membranes. So I think that that's really important because, you know, otherwise it's like, who would Narcan somebody if they had a chance of overdosing as well? You know, I think it's so important to kind of spread that message that Narcan itself is extremely safe, as well as the risk of overdosing kind of by proxy is also, you know, very rare. We have not seen that.
Yeah, and it's a good distinction to make because, like you said, years ago, whenever we were first seeing fentanyl roll in, those were the cautionary tales that people were being told. If you touch it, you could die, which, in a way, yes, but it takes that touching the substance and then putting it, like you said, near a mucous membrane. Natalie, in our meeting the other day, you mentioned a good tip of if you are ever in a situation where you are giving someone Narcan, hold on to the box, you said.
Yeah, so once I always tell folks if, you know, and the other piece too is, you know, yes, there may be fentanyl, and it's so important for first responders to have Narcan on their person for their own safety, you know, as well as their partners. If after you've Narcan someone and they're, you know, they're up, they're awake, and you're just waiting for first responders to arrive, just hold the box in your hand. If you're holding the box in your hand, because you might not have rubber gloves, if you hold the box with both hands, you're not going to be touching your face. And then as soon as the first responders get there, you can, you know, hand them the box and go wash your hands. I think that that's a good way to kind of safeguard and kind of helps folks kind of, you know, remember to not touch their face. Yeah.
Colin, are there specific areas within Somerset County or different types of demographics that are disproportionately affected by the overdoses?
I don't think. I mean, we see it all across the county. I mean, it doesn't care if you're rich, poor, where you live. It's everywhere, addiction. And, it doesn't show any favoritism towards any demographic.
Like you said, you've been in the office for 4 to 5 years now. What has the evolution of what you've seen in the opioid epidemic looked like?
I mean, now I think the biggest thing is we're starting to see the xylazine. You know, fentanyl's in about 85% of overdoses we have in the county. I mean, probably 9 of that 30 in 2022 had xylazine involved. 5 of the 14 this year have xylazine involved. So, I mean, it's on the rise, I'm sure.
Every so often, you've come along a new trend or something different. I'm sure some of it may take you by surprise.
Yeah, that's the biggest one that has stood out since I've been involved.
And I think too, you know, we saw the spike of overdose death during COVID. And partially due to deaths of despair of COVID. We saw the mental health crisis that came with COVID. But also, that's really when the infiltration of fentanyl hit. And so I think just educating the public about fentanyl and knowing, you know, that there is no quote-unquote safe drug. And, you know, it's interesting. I just did a Narcan training today, actually, but we do Narcan trainings out in the community, large groups, small groups, you know, whomever. And I always make it a point to say there is no safe drug, but Narcan itself is extremely safe because it only works on the opioid in the brain. And if someone has gone down due to diabetic coma, or, they've lost consciousness for some other reason. The Narcan isn't going to help them, but it's not going to hurt them either.
And that's a good distinction to make as well, because it's an epidemic, and just the situation we see with drugs in our communities, like you just mentioned, evolving. Year after year, month after month, something new. So that's a good distinction to make. You only, unfortunately, go to instances where someone has died from an overdose. Yes. The amount of numbers of just overdoses where people are revived from by first responders, that number is even higher than what you go to. Talk about the strain on offices like yourself and first responders with the amount of overdoses we are seeing.
Yeah, I think the biggest strain is on the first responders. Like you said, we're only called to it's helping us, our office, but the first responders definitely are taking it's a big toll on them, in my opinion.
Yeah, and that's something that we talked about too, even with Dr. Spencer. Compassion fatigue is a real thing for not only for first responders, but the healthcare field. And, that's where organizations like the Drug Coalition, like Drug Free Communities in Somerset County, and other nonprofits, I know all the other counties have similar entities. We really kind of try to step in and fill that gap and let the first responders know that people do recover. And even though someone might be Narcaned multiple times, they do end up getting into sobriety and into recovery. And in Cambria County, we actually just celebrated First Responder Appreciation Day, where we took coffee and water, and we actually filmed videos of thanks, and people that are in recovery actually filmed videos to say thank you. And I think that goes a long way, even from a community standpoint, to help reduce the stigma around substance use disorder and potentially multiple Narcan saves.
I would imagine the small sample size you've seen with the cutting your numbers in half, you're a proponent of getting Narcan out in the community?
Yeah, it's great.
It's that simple. Use it.
Yes.
Use it, exactly.
Yes, use it. Yeah, absolutely.
What are some maybe misconceptions? I think you kind of talked about it too. We talked about people who are afraid to, take that step as someone who's showing up to scenes where those efforts have been made. I guess what would you tell people at home?
I think you could save a life. There's nothing wrong with carrying it in your car. My wife carries it in her car. Yeah. Or our family car. Yeah. Sure. So it's great to have around, and you could save a life.
Yeah, and it's important too. It's just a basic first aid at this point, because fentanyl because fentanyl's in everything. It's not necessarily the old stigma of if they're stupid enough to use heroin, then the overdose happens. It's just part of life. It could be anyone that could use a recreational drug and experience an overdose, and you could have the opportunity to save a life. And we always say that there's sometimes the stigma around, Narcan's just enabling them to be able to use again. It's just keeping them alive to get them to possibly to treatment and to recovery. Yeah, as long as they're breathing, there's hope of recovery.
Colin, is there anything else you want to add or want the public at home to know before we move on to our next segment?
I think we touched on it pretty well, and
we appreciate you for your time. Thank you very much. And as officials continue to see the positive impacts of naloxone when it comes to overdose deaths, it does not treat the underlying issue, substance use disorder. There still needs to be a way out, a road to recovery for a person struggling with addiction. Our final guest is Kristen Shorts. She went through substance use disorder and is now in long-term recovery. Kristen, thank you for joining us, and kudos to you for getting to the recovery portion of this, because that's part of the point of having these conversations. We know how deadly these situations can be, and we want to get as many people as we can in recovery.
Yes.
And it's great to speak with someone that has been through the gauntlet of it. Tell us a little bit about your background.
One thing I want to make clear is that a lot of times things are talked about, like, trauma is involved with substance use disorder and addiction. And that's not always the case. And that's where the disease concept comes in, I think. And I just think whatever that X factor is that happens to you, it clicks something in there and it starts it. There wasn't trauma in my history. There wasn't, enough in addiction, but it just developed. It wasn't like I woke up one day, like you had said earlier, to be like, this is what I want to do. But once you get there, there's no way to explain to someone like why do we keep going, or it's just that there's just no way to explain that other than that we have a disease. That's the important thing to remember. And I always I have this like saying, and I can't not say it, but we're chronically ill, not hopelessly bad. It's not like, oh, addicts put them all somewhere, that's not the case. And no matter what, with like, the Narcan issue, with people thinking that maybe it's enabling, it's keeping people alive. And you don't know whether chance number 2 or chance number 37, they are going to get it. You just don't know. I mean, I didn't know. So it's just, I think it's hard to determine that. So the ability to get somewhere, whether it's treatment or the hospital or a first responder, whatever it is, and not be looked at like in a negative way.
Yeah,
because I think that definitely has a factor.
And you being here to tell your story with people is facilitating a conversation where that could be the new norm, where that stigma is removed. And like you said, not everything's cookie cutter. Everyone comes from different walks of life.
Exactly.
We heard from Colin a moment ago saying these drugs do not discriminate. They can affect anybody. Do you mind mentioning the substances that you had issues with?
I started, in high school, just like anybody else, thinking that this is just what you do in high school, I guess. Going to parties, drinking, smoking weed, But somewhere along the line, something happened, and somebody gave me some kind of pills one day. And that was my X factor. And I was like, it was just like everything went away. You know what I mean? It's like no stress, no nothing, everything, And I think that's, and that clicked, that awoke the dragon, if you will. And there was no coming back from it. And it multiple times it took. So, I mean, it became, I've had you name it, I've done it. And I will say, though, that I'm thankful that I was able to get into recovery not, sooner than when fentanyl started to come around. So I do feel lucky in that way, I guess. But I mean, because I can't even imagine. The drugs today are very, very different than when I was using. There was nothing, I can't even compare them. They're not the same.
But it goes to show still how drastic the situation is. You mentioned you still struggled, and that was before these additives and new drugs, evolution came along. Exactly. With or without them, addiction is addiction, and it's tough. And I want to mention something you alluded to. It's you can't explain, why you do it, because I feel like a lot of people who live a sober lifestyle or have not touched a lot of these substances. Their first reaction is like, look what it's doing to you. Why would you continue to do that?
Right.
Explain to me some of those irrational thoughts that were going through your head. Help us make sense of it.
Yeah, absolutely. I think of it as like very animalistic, if you will. So, and not always, it progresses, but once you get to a certain point, you're now using to survive. So basic instincts are what you're worried about. So, and instant gratification is like a huge thing. I'm not thinking in that moment, like it's doing all of these, negative things to me. I can't feel like this anymore. And that is one thing that I think, again, is just yet another thing that you can't explain, because someone who is going through the sickness of that, and again, especially today, if there was like a simulation that I could come up with to let people understand what we go through and what the thinking process is like and the obsessiveness, and when you're thinking, there is this moment sometimes, this moment of clarity that you might think, okay, this is a bad idea. But there's this huge thing on your back, like it doesn't matter that this is a bad idea. We have to do this. And that thing that, we carry, it's it's so powerful. And I mean, it talks you into things in your own voice. You know what I mean? It's just very, again, it's like, how do you even explain it? But yeah, you know, to think of somebody who is, you know, having these like xylazine wounds, right? Mm-hmm. You know, why would someone do that? But they have to do that. Yeah. And they can't function regularly if they're not doing that.
And one of the things that we talked about, and I think maybe what helps when you start to look at it from the disease perspective, is that all substances hijack our dopamine reward system. Mm-hmm. And so our dopamine in our brain is our contentment chemical. Its purpose in our brain is to help us form healthy habits. You know, you get dopamine if you go outside and take a nice walk. So maybe you'll go tomorrow and take a nice walk and get some exercise, you know. But whenever you put substances into your body, they work on the dopamine receptors, and then that forms those unhealthy habits, mm-hmm. and it just completely overrides the circuitry of our decision-making process. And I think the other piece too is, you know, if we get a disease in any other organ of our body, our doctor says, okay, this is treatment. This is what you need to do to be well. And our brain, which is the decision-making organ, says, I want to be well, so I'm going to make the decision to follow this treatment. Well, what happens when the decision-making organ is the one with the disease? It literally can't make that decision to follow that treatment plan. And that's why support and compassionate outreach for recovery is so important.
It's important to know, too, like, in recovery, it's not just quit using either, you know, right. and that's where we need to, you know, get people into treatment. We need to get them with, you know, support systems, CRSs, case managers, counselors, you know, MAT. There's such a stigma there. We need to keep them going. They need to know they have people, because there's so much stuff that has to happen after you put the drugs down. I mean, the brain can be rewired. Mm-hmm. It's just that you have to do all of those things. So whether it be someone needs to get into mental health, or someone needs to go to a 12-step program, or someone who needs to go to MAT, it doesn't, whatever, you have to figure out what works for you and stick with that long enough to continuously, like, figure out, why was it, and take accountability for what you did too. Mm-hmm. That's a big piece of it too. You got to know what the destruction that you had, and instead of continuing to use that as a reason to continue to use it as a reason to show someone that we can do it, because we're doing it. Yeah. People are recovering. Like, we're there, yeah. It's people that you don't even know, you know what I mean? You're a waitress at a place, a doctor, a counselor we're at Alliance, whatever, but we're there. Yeah. It's just, we're not talking about it enough, and we're not talking about, saving lives enough. We're not, I always said that, like, we're not under a bridge somewhere. We need to talk about it. We need to get it out there. That stigma needs to go away.
Just to clarify for our viewers, MAT is medicated assisted treatment. And so what that is it literally, we've talked about the devastation that the opioid substances has on the brain and how it literally causes brain damage to the neurons. Medicated assisted treatment simply replaces a healthy level of dopamine production in the brain so that the person can function and get well. It's just like skipping your coffee and having the headache. Mm-hmm. You have to have something to keep you out of withdrawal long enough to get healthy.
I liked your description of it, animalistic. It made me think of it's fight or flight.
Oh,
is that a good way
Survival.
to explain?
Yes.
Yeah, because it's like you mentioned, Natalie. It's the rewiring of your brain. The decision-making tool is the part that's addicted to this. So that makes sense as to sober brain knows these are the bad things we're doing, right. But we're in fight or flight mode, and we know that this substance is what my brain is telling me I need to feel better. And it's just that vicious cycle.
Yeah.
Yes.
Yeah.
That's exactly.
What are some misconceptions people have about people with substance use disorders?
A lot. Probably a lot.
Yeah. The floor is yours.
Right, I know. I think definitely, it's looked down upon as if we don't get better. We're going to continue to do this. We don't change. If someone has been Narcaned a few times, or if someone has been in treatment before, maybe 13 times. I mean, I've had people, that I've worked with that have had many, 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 many treatment experiences. And then along the line, someone says, like, they're never going to get it. They're never going to get it. Somebody said that about me as well. It's just that they're just bad people. That's not accurate. You know, that's not accurate at all. There's something in them, you know, scientifically that's true. It's not thinking in the right way. So I think, you know, just that we're all criminals and we all should be locked up, and, you know, that's just not the case. That's not helping. I mean, consequences need to happen. I do want to point that out. You know, without them, I don't know. You know, why would anybody quit what they were doing if they had no consequences, right? So the consequences of being sick, the consequences of going to jail, you know, but all of those things, it's like makes us, you know, bad person, like, you know, lock them up, throw away the key. They're never going to change. And it's just, it's not true, you know, but it is unfortunate because, you know, we do a lot of damage, you know, we do. And sometimes it's hard to rebuild that. So, yeah, I mean, I think it's just that main stigma of, you know, we're not going to change, we're never going to get it, or the, you know, talking about medication-assisted treatment, obviously. There's a big misconception there that we are just pushing drugs out and we're just getting, you know, and nothing's 100% true, right? You know, and nothing is 100% accurate. Yes, we have issues that we have to continue to work with. We are working in the trenches with people in late stage addiction, you know, and they need help. And so it's just important that we know that we're not up there just, you know, like, oh, okay, we're just going to push drugs and we're going to enable and continue to enable them. That's not what's happening. You know, when you see someone go from the lowest point of their entire life, I can't even explain, like, if I could, like, bottle up and give it away, like, we could all, like, get clean so fast. But watching it, I mean, like, it's so far outweighs, you know, like when you see somebody come from rock bottom and they, like, you know, they scrape their way up there and they get it, and they have, you know, they're getting their kids back and they're rebuilding relationships and they're getting their own place, like so many things that are happening, and you see light back in their eyes, like it's just, it's pretty cool.
Yeah, it's hard to beat that. And to clarify for everyone watching at home, if you want to touch on that is what you're doing in your recovery now. You're helping those that are in the initial stages of recovery, correct?
Yeah, I'm trying.
Yeah.
Not an initial, late stage. We work with everybody.
Okay.
So I have a large caseload of people that is all different. Ones that have been doing well for many years, you know, sustaining businesses and all that stuff. Some that are in, you know, they're in that part where they don't know where to go from here. They don't know if they want to quit yet, to be honest. You know, it's a population that people don't want to work with. And it's hard and it's stressful, but, you know, that's just what I do. That's what I want to do. I want to let people know that it's possible, and I'm here to get you to point A to point B to point C, wherever we need to go and whatever we need to do to get there. But, you know, yeah, like I said, there's late stage addicts in there too, you know, that we just gotta hope that, you know, on that 38th time or whatever it is, they're going to get it, because you just never know. So you never want to have that, like, well, I don't want to work with them, or because that could devastate the chance.
Yeah, and when we talk about all walks of life being affected by this, everyone's different in the time that they decide, now's my moment to get clean. Kind of talk about that, because at the end of the day, it has to be the person going through the substance abuse disorder to be, it has to be their call. Because I'm sure you've seen maybe in your own recovery, and now as someone who's counseling others, I'm sure you've seen people try and try again. They weren't ready for it and it didn't work out, but that 5th, 6th, 30th time,
exactly,
something clicks.
Yes. I work with personal and working with it, you know. It wasn't, you know, one time and I got it. Wasn't that way. And, you know, sometimes I see people have like a burning bush moment. Something happened to them and they hit that bottom and they're like, I'm done. but that doesn't always happen. And so I think that what's important to know too, and like to let other people that are struggling know that it's okay if you don't think you're ready, because even if you try, somewhere along the line, you realize in there, like, life is better.
Yeah.
You know, just because you might not decide right at that moment, I want to get clean right now, you know, because I really didn't do that. My first thought, you know, in this time, like, wasn't, okay, today's the day. Right? You know, I want to get clean. I'm done doing this. That's not what happened. What happened somewhere along the line was there were people that impacted me, and there were, you know, moments where I realized I don't want to do this anymore. I had exhausted all options. I've, you know, gone through, you know, this way, that way, whatever, loopholes that you couldn't even think about, to try to not live that way, you know, just to like, I can do this, I can function, but I had like oh, nope, can't do that. Okay, can't do that, you know, and consequences came. And once I started realizing that, you know, I got hooked up with good people, and I just worked hard, man, you know, I worked hard to turn myself around and take accountability and try to rebuild what I could. And luckily, here we are, you know, but you can't get it's cocky either, you know, for someone in long-term recovery. You never know. So it's literally every single day that we have to remember, you know, we can't do this anymore. Now, you know, today, obviously, years later, you can think through a lot easier. You know, that instant gratification isn't there as often. Yeah. But it's definitely like, you know, life is good. It's a better way of life. And you got to just get through this area in the beginning where you think, what is this, what life looks like? Because that's something too. You get into recovery and you're like, bored. That probably sounds bad, but it's true. You're bored. You have no idea what to do. You're used to getting up and ripping and running all day long. And so, and you need to have people to talk to, you know, you need to have things to do. You need to focus on keeping yourself busy. There's just a lot of things you got to do, and you might not know what to do, but you got to figure it out. That's what I did. You know, I just tried whatever, you know?
I think, well, and another thing too, you had said a couple things. One, I think that's really important is, as much as you went after your addiction, that's how hard you have to go for your recovery.
Yeah.
You know, and I think that, you know, but to your point, it's getting to that moment in time and knowing how to get help. Right. I think that there has been, you know, if our house is on fire, we know to call a fireman. If we have a loved one in active use, or we ourselves are experiencing substance use disorder, who do you call? And so that's where, you know, we are trying as the coalition to get the word out that treatment is available. No cost treatment is available through every county in Pennsylvania, through every single county authority, or every, you know, in Cambria County, it's the Cambria County Drug and Alcohol Program. Each county has its own name, but every county has funding for treatment, and it is available. But it's that perfect mix of moment in time for the person in active addiction, and then someone with compassion to show them the way out.
Having kind of that support system, like you said you had key figures in your life, a lot of others going through the same situations. They could point to, you know, mom, dad, brother, friend that really got them going. What would your advice to loved ones or friends of someone going through SUD? What would your advice to them be?
To the loved ones?
Yeah, the person not in addiction, but with a loved one of theirs going through it.
Hang in there.
Yeah.
Hang in there. And all I can say is that, you know, the reality of the situation is sometimes there's going to be a point where you have to get to that you say, I can't help you kill yourself anymore. I can love you from here, but I can't
love you to death.
Yeah, right. Sometimes there's this, you know, feeling, obviously, of a family member that you don't want to say that you have to get out of the house, or I'm not going to help you pay for this anymore, or I'm not going to, you know, whatever those things are. And that's, how do you tell a mother or a sister or brother or somebody that you can't help them that way. But sometimes that's what has to happen. Hopefully then when they make that decision and they come back, you can, rebuild those relationships, hopefully. But it's so tough. And to be honest, it's harder on their end, I feel. Because now being on like both ends, and I watch it go, like it's how do you watch someone kill themselves? I mean, how do you watch that and just continue on, And we get very good at pulling the wool over people's eyes, you know what I mean? So after a while, you just have to be done, because like I said before, if you would continue to do something and you have no negative consequences, why would you ever quit doing it?
Yeah.
Right?
Yeah.
I mean, and for anything.
For anything.
Right. So,
well, and that kind of, we're going to talk a little bit about compassionate outreach for recovery and that new initiative that we have happening at the Drug Coalition, but it gives family members an opportunity, or anyone an opportunity to say to someone in active addiction, I can't love you to death. I cannot, support you killing yourself anymore. But when you're ready to call for treatment 24/7, I will be here. I will make that call with you. I will do anything I can to help you get well, but I won't do anything to keep you sick. And I think that's a hard boundary to make. And we have to have all the compassion for loved ones that aren't able to make that boundary yet, because how do you tell your loved one that you're not gonna you're gonna leave them out asleep out in the cold?
Because what happens then if,
right, God forbid.
Exactly. So that thought, I think, is always there. And that's just one thing that, like I said, support's so important. So it's like to know that you have that person, but, you just got to stop abusing them, And how many times have we heard an addict say, I'm sorry, right? How many times? 1,000? 5,000? And it's like, I just can't listen to it anymore, right? But we do mean it. Right? It's just that, there's this other thing happening that is larger than that, far larger. And like I said, compared to my time and the drugs nowadays that are so much worse. So, it's just that I think if there could just be a little bit more understanding of what's going on, a little bit more realizations that like we aren't bad people, we just need help, and sometimes it's going to take a while.
And Natalie, that works perfect. Talking about the showing compassion, that's what you brought here. Explain what we have in the bag here.
So last year in August, we really started with the Cambria County Drug Coalition in partnership with Cambria County Drug and Alcohol Programs, getting that Narcan out into the hands of the community. And we really have seen, and Alliance has been doing an amazing job with getting Narcan out to, their folks that are coming in for treatment, and also getting that to then other folks that are still in active addiction. And so it's just been a huge, very much orchestrated push to get Narcan out. And we've seen that work. And so we are keeping people alive. But now it's time to save their life and get them into the recovery. And how do we do that? How do we create that moment with a person in active addiction? Dr. Spencer touched on harm reduction, touched on xylazine test strips, fentanyl test strips, certainly safer use practices. So that's where the Compassionate Outreach for Recovery, or CORE, was born. It's a bag right here. And it has Narcan, it has basic first aid and wound care, obviously, for those tranq wounds that we talked about, fentanyl test strips, xylazine test strips, condoms, information on safer practices, and, start low, go slow, don't use alone. And then the most important component to this bag is the 24/7 number for treatment, and saying to that person, when you're ready, I will be there to make this phone call with you. And if we can get this, we have funding through the Community Foundation. We're in the process of creating 1,000 of these bags, and we're going to track how many people call for treatment based off of receiving a bag. So we can know it a year from now how many people got into treatment based off of this initiative. And we're going to be pushing this out to first responders, to partner agencies, to anyone that might come in contact with someone in active addiction to just say, you know, you feel like you're completely in a dark place. This is the way out. This is the phone number. There is free treatment. And, you know, 24/7, that person on the other end of the phone will get the process started, will contact, you know, cut through all the red tape of, you know, getting the insurance figured out and all of that. Because when you're in that space, you can't do that. So that's what our initiative is, and we're just beginning to launch it. We're actually working on Friday to create the bags. We have volunteers coming in. So really an exciting opportunity to hopefully next year, when we're having this conversation, say, yes, we are keeping people alive with Narcan and saving their lives, but we want to get them into recovery as well.
Oh, that's wonderful. Kristen, like you mentioned, Natalie, there's a entity, there's a single county authorities in each county across the state, and other entities that do wonderful programs like this to try and show that compassion and do what they can to help those that are trying to get to recovery. What does an effort like this do to a person who wants to cross that finish line, but they realize they need help to get there? What do acts of compassion like this do for your mentality going through that fight?
I think the difference between, you know, asking for help and not, like literally, you know, making that step or not, because if it's something that, like earlier when I mentioned there's the moments of clarity there, at 3 o'clock in the morning, if I'm home and I'm, you know, going through it, and maybe I have something like that with a number or something that I saw or I heard, you know, reach out to us, you know, in that moment, because, you know, 20 minutes later, you don't know what's going to happen, right? And 20 minutes later, it could be not good, you know? So it's like those moments do happen, you know, and that's when something like that, where you know that you could call someone. And the difference between being treated like a human being instead of an addict, you know,
a junkie.
Exactly. Right. I hate that word.
Yeah.
And it's like, that is like, just stop that. You know what I mean? Let's help people.
Well,
let's help people.
We know we've gotten this far in the opioid crisis, right? We've been doing this for a minute.
Yeah.
We know a few things. We know just say no doesn't work, right? We know we need to do better prevention for kids. And we know that telling people that they deserve to die does not inspire them to live.
Right.
And so let's stop doing that. If we ever want to see our community, because I think we can all agree that substance use disorder and the opioid epidemic is not only a devastating situation for the individual and for the family, but for the community at large. So if we ever want to see our entire community recover, we have to shift to compassion. We're at the end of the rope with the other one, right? You know, and I don't want to say like tough love, but like we're at the end. Telling people that they deserve to die isn't inspiring them to live. So let's stop doing that. Let's tell them they deserve to live, and we have a way to get them to a better life.
Right.
Kristen, before we wrap things up, is there anything else you want the public to know? Anyone that were once or currently in the shoes you were once in? Anything you want them to know?
Someone told me once, so it's like not my thing, right? But don't leave before the miracle happens. So that to me is like, if you take that step, if you think there's no hope, there is, you know, there is. And call Alliance, call us, call me, call somebody, you know what I mean? It's because it is available, and there are people that care, and there is ways to, you know, get you into treatment. And it's okay if, you know, maybe some people are, I'm going to fail. It's okay to feel that way. Do it anyway, right? Like, just try it, you know, because chances are you've tried a lot of other things, right? Like, we'll probably try anything once. Yeah. Why not try recovery, right? Yeah. So at the end of the road, like, what do? Well, welcome to recovery. Come on in, you know, like, it's just really, you know, we're here to help. And I just want people to know that, and that it is possible for them even when they think it's not. There's never, ever, ever a time until someone stops breathing. There's never like no hope. There's always hope.
Kristen, thank you so much for your time, and thank you for being a voice that can inspire others to get where you're at in your recovery.
Thank you. Thank you.
And that does it for this 6 News special town hall. We want to thank all of our guests for coming and joining us today to facilitate this conversation and give us great insight to a topic that is impacting all of our communities. We appreciate you watching.
Sponsored by Somerset Single County Authority for Drug and Alcohol.